afternoon. My name is Matt Kelly. I'm Health Officer with Gallatin City County Health Department. First of all, I want to thank everyone who's working so hard every day to reduce the impact of this pandemic. Most of all, our healthcare providers, our public health professionals, emergency responders, and our partners from across government, academia, and other sectors who are working tirelessly to weather this pandemic. On Saturday, Gallatin City County Health Department and the Department of Public Health and Human Services confirmed 4 new COVID-19 cases in Gallatin County, bringing the total number of detected cases in our county to 8. Our public health professionals have completed an initial assessment of those new cases, including an assessment of their exposures and contacts in the community. Prior to Saturday, all 4 cases detected in Gallatin County had some sort of exposure to a case or an outbreak happening outside of Gallatin County. The 4 new cases confirmed Saturday do not have a known travel history, exposure to someone who traveled, or exposure to a known COVID-19 case. Based on that information and that assessment, we now feel it's important to inform the public that we are seeing the first indications of community transmission in Gallatin County. That means we're seeing spread of an illness where the source of infection is unknown or cannot be directly traced back to a known exposure. This is not surprising. We've known this day was coming, and we've been working hard with partners to prepare the community. As a result of that work, our advice for the public also is not changing dramatically. The greatest advantage we have over this virus is our own discipline and willingness to distance ourselves from others. That means stay home when you're sick. Even if you are confident your symptoms will pass, know that contact with others can put them at great risk and increase the risk to our community. Avoid groups of people and stay home whenever you can. Wash your hands frequently and thoroughly, and clean and disinfect frequently touched surfaces regularly. There is a temptation in these difficult times to focus on the small bright spots. And we should be reassured by data that tells us 80% of people who contract this disease will suffer mild symptoms, which means that people who are sick can stay home and rest. And we should be relieved that young children seem to be weathering this virus without serious illness. But I urge you all to guard against the danger of allowing these comforting bright spots to lull us into complacency, because complacency will cause us to gather in groups in ways that will allow the disease to spread. Complacency will cause us to make small decisions that may seem trivial, decisions to not wash your hands or to go socialize with friends, decisions that will allow this virus to spread silently. This sort of complacency will cause 1 case to grow to 2, 3, and 3 to grow to 9 and 12, and on and on. Complacency will speed this pandemic along, upend our healthcare system, and cause preventable new cases and deaths. Now is the time to pay attention and take this seriously. Now is the time for each of us to take personal responsibility, not just for ourselves, but for our fellow humans, many of whom are over the age of 60 or have weakened immune systems or underlying healthcare conditions. We are asking everyone, especially the young and the healthy and the confident, to make decisions now that will prevent spread and save our healthcare system to treat our mothers and fathers, friends and neighbors, colleagues and acquaintances, people who may need oxygen or a ventilator, or the intensive care of doctors and nurses in order to fight off this virus. There is no magic pill. There's no vaccine that will save us in the near future. We find ourselves fighting this fight without enough tests or testing supplies and nationwide shortages of personal protective equipment. And information seems to change day by day, hour by hour. I know all of you have many questions, and we often do not have the perfect answers. We are working in a new frontier, but we will weather this storm. This won't last forever. We're going to be okay. And our greatest strength in these trying times is going to be our shared willingness to sacrifice for one another, to distance ourselves by staying home whenever we can, by avoiding gatherings of people, and by keeping the distance that defeats this virus. With that, I'll take some questions. Yeah. So you might hit *6 to unmute yourself. Is anybody out there? Can you hear me?
Yeah. Is this the first? Oh, is this the first community in Montana that has suspected community spread?
You know, I would refer that question to the Department of Public Health and Human Services. I don't want to speak for the entire state. I can tell you that I've been in touch with my fellow health officers from other large population areas, and that may be the case, but I would want you to confirm that with the Department of Public Health and Human Services.
Okay. And wondering too, the governor took actions last week shutting certain businesses, but given the situation now in Gallatin County, would the county consider putting in further restrictions beyond what's already in place?
We're not considering any further restrictions at this point in time. We have been in touch with the governor's office to work to harmonize the orders and the emergency rules that are in place. At this point in time, I don't anticipate any further rules or restrictions.
Okay, thank you.
Any other questions out there?
I think one thing might be helpful, just if you could walk through just helping us all understand the definition of what community spread is versus these cases we've seen associated with travel, or even like the Board of Regents meeting in Dillon, and just how this is different, just so making sure we all understand that.
Yeah, I think it's important to know that whenever we get a case, what we're really looking for are the contacts that the person who was diagnosed had before and since they were tested. And we're really looking to see where they may have contracted the disease. And then up until Saturday, every case that we had, we were really able to draw a pretty clear line between that person and some other either foreign travel or another known case outside the county or outside the state. With these new cases, that's not the case. There's not a clear idea of where the infection came from. And so that's a pretty good indication that they picked it up somewhere in the community. When you don't have that level of travel, when you don't have a known contact with somebody with a known case, that means they've gotten it somewhere else, probably in the community. Does that help?
Yep, definitely. Thank you. And I don't know if understanding you can't speak for other counties, but just looking at how we travel around in Montana and just how kind of connected we have been, and understanding people are trying not to be right now, but does this sort of change the picture for other places, or is this pretty localized to Gallatin County, or just trying to understand if there's any implications outside of the Bozeman area?
Yeah, so the question was whether there's implications for the new cases in Gallatin County for outside of Gallatin County. Everything affects everything else in this situation, but I'm not going to say that there's major implications, that there's not at this point in time. I mentioned there's a lot of good questions that we don't have all the answers to right now. We're going to have to see how this develops. What our goal is today, though, is really to share the information we have. We think this is valuable information for the public to have, to know that we're seeing this here in Gallatin County. I hope that we can continue to see evidence of slow spread throughout Montana, but we wanted to make sure we were getting out there with this information, say what we're seeing in Gallatin County.
And do any cases have any relationship with one another?
At this point in time, what's interesting is we have not linked any of our cases.
Is there any sort of timeline that public health officials are watching, looking at people are being encouraged to stay home right now? to sort of assess how Montana is doing with that and see if we have sort of been able to flatten the curve? Are there, is it a month out or two? Like, I'm wondering sort of what time frame you guys are looking on to sort of assess how things are going based on measures people are taking right now.
So the question is whether or not there's a time frame where we think, we'll know whether we're doing well at flattening the curve. And I think it's day by day, week by week, month by month. We're in this for the long haul, but we're looking at the data on a daily basis. We're talking to health officers in other counties on a near daily basis. And we're connected to the governor's office on a regular basis. So the answer to your question is there's not a really set time frame. We're looking at it on a day-to-day basis, but we know this is a week-to-week, month-to-month fight.
Okay, thank you.
I know it's Sunday, but there must be other questions out there, folks.
I have a question. Do we know if any of these new cases, if they failed to follow some of the recommended preventative measures, like avoiding gatherings or anything like that?
We've had, for the most part, pretty good, but not universal adherence to the self-quarantine. We are seeing some instances where there hasn't been perfect isolation after testing, but for the most part, we're seeing pretty good adherence to that. And I think it's a great question, and I think it's something that we have to emphasize. If you are sick, how important it is for you to stay home, how important it is for you to minimize the number of contacts you have. Even if you think it's a mild illness, even if you think it's something that is going to pass, we know that those are sometimes the cases that can spread this disease. So I think that question is a great way to start talking about and continue to talk about how important it is that people stay home when they're sick, especially if they've been sick. Go ahead.
Well, I was just saying thanks for answering.
How are our healthcare workers doing right now? Are they prepared for this oncoming number to grow?
I think they're working every day, every hour of every day to get prepared. And what we're doing in public health is trying to give them all the time we can to become prepared. We know all you need to do is open up a newspaper or turn on the television to know that there are shortages, to see what's happening in New York and Chicago. We're trying to stave that off here locally. I think the Bozeman Health is working hard here locally to be prepared, as are other healthcare providers.
So given the limited number of tests, how does this news change who gets tested?
This news specifically really doesn't change it. I think it's a collection of events, and that's a decision that'll be made, based on a lot of different things, not just the 4 new cases that we have here today. The question there was whether the 4 new cases we have changes how we do testing. And the answer is it doesn't change it dramatically immediately. It just adds to the preponderance of the information out there that informs those decisions as they're made. Any other questions out there?
So just a clarifying question, now that we know that this is being spread from within the community, will more people start to get tested regardless of travel history?
Like I said, this doesn't really change the testing regime. The other thing I would say, I want to emphasize, there has been a great deal of emphasis on testing, and it is undoubtable that we need more tests and that we need to build our capacity as a nation to do testing better and to do it more frequently. But I also want to stress that if you're home, if you have mild symptoms, having a positive or negative test really doesn't change your treatment. It doesn't change the advice that we give you. If you have a positive test, we're going to tell you to go home and rest and drink plenty of fluids and eat healthy foods and call your doctor if you get worse. If you have a negative test, we'll probably tell you the same thing. If you have no test, we'll tell you that. I'm not making the argument that we don't need more tests. We absolutely do. But I want people to understand that getting a test does not suddenly solve the problem for you. Getting a test just helps us understand the epidemiological situation, and it may help you make some choices, but it really doesn't change a great deal if you have mild symptoms. If you have mild symptoms, what we want you to do is stay home and take care of yourself. That's the best advice you're going to get before or after a test, whether you have one or not. Okay, if there's no other questions, we'll end, but I'm happy to take another question or two if they're out there.
How are you doing?
I'm good, and thank you for asking. I'm doing really well. I think I put it out there that I was diagnosed with influenza about 3 days ago. I've been in close contact with my doctor. I'm feeling great and ready to get back in the fight. I've been working from home, driving my family nuts probably, and ready to get back at it. But thank you for asking.
Glad to hear it. Yeah.
All right, folks, thank you for your time. We'll be back in touch. We're going to keep communicating on this. Our goal is to provide all the best information we can for the community as soon as we can. That's why we were communicating last night, and that's why we wanted to make sure we were in on Sunday and offering this information. Have a great day. Everybody enjoy the sunshine today and be well.